All right, so let's get started. First thing is, well, if you don't know, my name is Charlie Voss. I work for SEPA. I'm the HSSN chair, and I'm going to be leading the meeting today. So I wanted to remind you all of the public comment process. Barton is going to post a link in the chat. Just a reminder, there's two different ways for you to provide feedback or comment on our homeless system: a standing public comment, which will be added to our monthly meeting agenda. Comments are limited to 2 comments per meeting and at the designated time, and you're given each 2 minutes. So Adam and myself, so the chair and vice chair, will work with the county staff, and if the public comment process needs refinement, to request to make a comment during our meeting, you can direct message your request within the Zoom to Lindsay Dent, and you do that by 8:45 a.m. So in about 10 minutes, if you would like to make one, you would just send Lindsay a message and just include a quick topic description and the organization you represent. The first 2 requests that we receive will be provided an opportunity to speak again for 2 minutes. Additional comments can be submitted through the public comment link that Martin will be posting in the chat. And if if there's no request for public comment, then you'll need to just follow the link. Unfortunately, with the time crunch, we can't allow open floor, yeah, and all that stuff. So cool. If you have a comment, please send that to Lindsay by 8:45. Otherwise, you can follow the link Martin has posted. Okay, so we're going to start with a program update from Katie Gentry from the Homeless Services Division. Katie, whenever you're ready, take it away.
Thank you, Charlie. For those I haven't met yet, Katie Gentry, I use she, her pronouns, Washington County Homeless Services Manager, replacing Catherine Gallion, if you knew Catherine. And I will be stepping into this role. Nicole and I you'll see both of us, but most of the time you will see me providing updates from Washington County. For folks who are contracting with Washington County Supportive Housing Services and Continuum of Care grants, those contracts, you all, I know, have been actively working with us on those contracts, and you will start receiving those contracts through the contracting process. They started going through our contracting process this week, and in the coming 2 weeks, you will start to receive those contracts from us. So be on the lookout for those, with the ideal that they are getting signed by the end of the month for contract start on July 1. We have some COC contracts that won't start that contracting process quite as fast because we have not finalized our HUD contracts yet, but those are also forthcoming. Update from on budget things. The president's full budget has been released. We don't expect that to go well in Congress, but the big, beautiful bill that we are not thinking is as big and beautiful is been released. A lot more forthcoming as that navigates the congressional process, but it's definitely on our radar and moving through. And then state revenue, we're also watching state projections. So state revenue, they came out with their revenue projections, and their revenue is projected to be down. And so we are doing additional outreach to legislators specifically about shelter funding and the shelter bill that is moving through the state. And the Housing Alliance has been working on an advocacy letter and a sign-on. And so if you are interested, please reach out to them to sign on to that letter. Really, that shelter funding is really needed in our community to continue the shelter system that we've set up. And then last thing for us outside of budget and more into programmatic, we had a workshop last week, but many more things to come from our house at Washington County around program manual updates and things to come for July 1. So if you have questions, feel free to reach out to me or anybody from my team. I will drop my name and information in the chat for folks to reach out to me. Any questions from you all on any of those things? Great. Charlie, I will turn it back to you.
Thank you, Katie. Just a quick update, everybody. Lindsay is not logged in quite yet, so if you do have a comment, go ahead and send it to Meredith, but it'll be the homeless services tag in your email. I mean, in the chat, not your email. All right, so we're gonna move on to speakers today. And first we have Adrian and Michelle from MHAAO. They're gonna be talking to us about peer support programs and services offered. When y'all are ready, you can take the floor.
Thanks so much. And is it okay if I share screen? We've got some slides.
Yeah, absolutely.
Okay, thank you.
Okay, well, good morning, everybody. We're so glad to be here. My name is Michelle Marcus, and my amazing coworker, Adrian. Would you like to say hi?
Hi, everyone. I'm Adrian. Go by Adrian or she, her, and really appreciate the invitation to be here today. So thank you so much.
Thank you, Adrian. So we're really excited to be able to come on here and share some of our amazing parts. I thought we would get started taking a couple of breaths. What that looks like is we're just going to do a short, just 3 breaths. We're going to breathe in for 4, hold for 2, and breathe out for 6. Just can be done anywhere, but we're going to practice right now and then just giving you a mindful tip for your future. So let's start. We're going to breathe in for 4, hold for 2, and breathe out for 6. Let's do it again. Hold, breathe in for 4, hold for 2, and breathe out for 6. Each time I can feel my shoulders drop a little bit. Let's do it for the last time. Breathe in for 4, hold for 2, and breathe out for 6. Thank you. I just thought we would just kind of ground down and come into the moment. So who are we? We are Mental Health Addiction Association of Oregon, soon to be the peer company, which will be official in September. So you'll be hearing a lot about soon to be, and nobody's going to say we are currently. So just so you know, we are an inclusive, community-based organization dedicated to self-direction, honoring the voice of lived experience. And we are a peer-run organization, meaning that we are led and staffed by people with lived experience, mental health, or addiction, or both, including our board of directors. We have 51% peers. The services that we provide include direct peer support, technical assistance. We have training like peer wellness specialist, peer zone facilitation. We also do technical and assistance and consultation, and all from a peer recovery perspective. Our core values include the belief that recovery is self-directed process that is possible for all. We firmly believe that recipients of our services have the right and the ability to make decisions for themselves about what supports they would prefer to receive and the direction they wish to explore. Our role is to offer support towards mutually agreed upon goals. And I'll hand it over to Adrian and she'll explain a little bit more about peer support.
Thanks so much, Michelle. So peer support, some folks here may be peer support providers, may be familiar with peer support, and for some folks it may be a little bit newer. So we wanted to take a minute to orient in what peer support is before we get more into a little bit more detail about some of the programs and initiatives that MHO has, as well as opportunities to connect and future opportunities too. So peer support is a person-to-person approach to recovery where we use our lived experiences to support, empower, encourage folks that may be starting out on their journeys. And it's really important in peer support to meet folks where they are at. So this is not something that we go into with an agenda of our own, but like Michelle was saying, having those mutually identified goals, really working with the person receiving peer support services to identify what would they like their life to look like? What would they like to be moving towards? And the quote we've got listed here is from Sherry Mead, who is the founder of Intentional Peer Support, which is a specific model of peer support that provides trainings nationally and internationally. And that is a system of giving and receiving help founded on key principles of respect, shared responsibility, and mutual agreement of what is helpful. Peer support is non-clinical. Peer support is voluntary. And those aspects of it are super core to the peer support model because it's all about honoring the voice and choice of the individuals that are receiving peer support services. And peer support is really a very key part of the services that MHAO, soon to be the peer company, holds. And then I'd like to take a couple minutes to talk about some highlighted programs and initiatives. So first off, I have to say MHAO has so many different programs and services, especially within our Evolve department, which has over 40 different direct service peer support programs. Some of those programs may have a bunch of peers supporters working within them. Some of the programs are a bit smaller, so it may be one or two peer support specialists or peer wellness specialists supporting peers. So we offer community-based peer support through Evolve, through the Behavioral Health Resource Center in downtown Portland as well. We operate the day center there, which is open from 8 a.m. to 8 p.m. every day. Super open services. And then we also have Kaiser peer support programs as well. In addition to that, we also have Optic, which is the Oregon Peer Training and Innovation Center. And that is really where our Oregon state approved certification trainings for the workforce are housed. So we provide peer wellness specialist training for folks that are hoping to become certified and enter the peer delivered services workforce, folks with lived experience. And then we also have continuing education to support the workforce or to support others outside of the workforce who want a little personal or professional development. And then we also have our Peerpocalypse Peer Leadership Conference, which I'm curious if anybody here has been to Peerpocalypse or heard about Peerpocalypse. It was just last month, so it's pretty fresh of mind. Well, y'all can let us know in the chat. But Peerpocalypse, we started that in 2013, and it is a peer-led, peer-designed gathering, a peer leadership convergence that we hold every year and is an opportunity for folks with lived experience to come together, connect, to learn, to grow, to do fun things like the Mad Hatter Dance or talent show, to do continuing education like ethics courses, to listen to amazing speakers through our keynotes. So we provide a bunch of different services, but everything we do is coming from that peer recovery lens. We are people with a variety of lived experiences, including up to 51%, at least 51% of our board of directors. And that's something that's really, really core to what we do. And then I want to share a little bit about a couple of additional projects, some of which you may have heard about at this group through the awesome Michelle sharing here, but previously through some announcements. So one project we've got right now is our Oregon Housing and Community Services, OHCS, Collaborative Lived Experience Engagement project, where we've had the privilege and the opportunity to connect with folks with lived experience of housing instability and or houselessness who have connected with us through an online survey and through listening sessions that we've hosted and that our partners have hosted as well. And through that, we've learned some lessons and shared information back to OHCS to help improve and inform programs services, and policies. We also have our Growing Oregon Peer Leaders GOPL Leadership Development, which is for peers with mental health lived experience who are leaders or who are emerging leaders. And through that, we provide 5 Leadership Institute workshop sessions where we support those leaders to grow and develop. And then we also have pre-workforce skills training, which is a partnership through Work Systems, where through our optic team, we are supporting folks who may be hoping to enter the workforce, but maybe have some skills that they want to develop a little bit further. Maybe that's computer skills, maybe that's resume building skills, maybe that's just preparing to work in a more office environment, whatever that might look like. So we have a bunch of different work that we are involved with at MHAO. And then I'm gonna check the chat. Okay. Great. And then we also have some opportunities for involvement that Michelle is going to share about, including one of the other initiatives that we have, which is our Workforce Support Initiative, Peer Support for Peer Support. So I'll hand it over to Michelle.
Thank you, Adrian. You explained all that so well, and I'm so excited to see that some of our folks here have actually experienced Perpocalypse and have been there for the first time, and it is such an amazing experience. So our workforce connections, we have this morning at 10 a.m. Peer support for peer support. And that is for folks who are currently working in the field or people that want to work in the field, want to see what, get an idea of what that looks like. Maybe have taken the training but don't have a job yet, or are going to be trained or interested in training. I encourage you, or somebody, if you know somebody, not necessarily you, maybe, but if you know somebody, encourage them to come. It's a great place. What's amazing about it is to start coming and build the connections. So then when you need it or you need tips, a lot of us have big hearts, and that's why we're in the field that we are in, and we need to support people so we can have more resilience in the workforce. And this is one of those ways. Also, we have Peer Zone for peer support specialists. That is a curriculum that we have. It's incredible. Peer Zone also is on, you can get free resources for Peer Zone as well. You don't just have to be a facilitator to get some of the resources. It's amazing to share with your peer support folks if that's something that you're interested in, and that is tomorrow at 3 o'clock. You can register for those events on our website or right here. They're really great to come to and to start working the process. And then also we have on the next slide, peer support referrals. You can refer yourself. They can be self-referral, or you can help somebody get a referral. And we will figure out what kind of support and depending on where you are and what you need from your referral. So we also have that available as well, and that is free. Anybody, you don't need to pay to have a peer support. It is covered already. So please share. We want to share the love with everybody we can. So, and then next we have our future opportunities that Adrian could talk about.
Yes, thank you, Michelle. So we have a couple of upcoming opportunities that we wanted to highlight, and then after this, we will open up for any questions. So the CAT, the Center for Addictions Triage and Treatment, our organization was selected to develop and operate a peer drop-in center at the CAT, along with a number of other provider agencies who will be working together, like CODA, Solutions Group Northwest, LifeWorks Northwest, I believe, and Project Homeless Connect. And in July, the Hillsborough Recovery Center will actually start providing services on site. So some of the folks here may have been a part of that process, may remember when when the cat was an idea, a dream, some years ago, and now really cool to see that it's been, construction is happening, and at the Hillsborough Recovery Center, services are going to be happening just next month. So really cool to see that being realized. And then we also wanted to share our MHAO events calendar, and we've got both the link and the QR code for whichever is most convenient for folks. And the event calendar includes the workforce support initiatives, which are provided at no cost, that Michelle was talking about. If you want to check out when those are scheduled, you can go to that link or use that QR code. And then we also have information about the trainings, including our foundational certification trainings that are going to prepare folks for a career in peer-delivered services. And the certification training is also required by many employers to obtain a job in peer support services. And then we also have, for folks that may prefer online, at your own pace trainings, we also have some online continuing education units that are available at the last link on the page on our Learn Worlds site. And then at this time, I'd love to just open it up for questions. And we've also got our contact information if y'all think of something and then want to follow up with us. Let me see in the chat if there's any questions. Okay, Chris asked, do clients have to have an SUD diagnosis? No. That is not a requirement. There are some programs that are more focused upon serving folks that may have experiences of SUD, but that is not a requirement for all programs. And with the referral form, you may have noticed we have one referral form, and then we have coordinators and team members who are looking at that, who are determining, okay, based on what this individual has shared and what their needs are, they may be eligible for these specific services. And then some services that we provide are tied to a specific program. For example, services that we've got at OHSU, Project Impact, that's more tied to folks that are being served there. And then I see there are a couple other questions, so I'm just taking a moment to read those. Chris, I see your comment and I would love to follow up with that. I'm wondering if there maybe was interest expressed in a specific program, because we definitely serve folks who have mental health diagnoses without having SUD as well. So I've got my information there. Love to connect about that. And then Karen asked, are there volunteer opportunities? At this time, we don't have a ton of volunteer opportunities available. We do post things on our website, like when we have our Peer Apocalypse Planning Committee, which the conference was just last month, and the planning committee will actually start meeting pretty soon to start planning for the conference that will take place in 2026. So that's one volunteer opportunity that we have. And we sometimes have other opportunities like that. We don't currently have direct service peer support opportunities. Those services are provided by our trained, certified, and supported staff members. And then, okay, the next question, you serve all counties. So we currently, for our direct peer services, those are mainly occurring within Washington, Clackamas, and Multnomah counties. We also have programs that serve in Washington as well, but much fewer programs and peer supporters available under that. And then, yes, we do have bilingual mentors / peers, and we have a Latinx culturally specific program as well within MHAO. Thank you for those questions. And I want to check in about how we are doing on time. I believe there are other presenters, so I want to be respectful of that as well.
You've got about 2 minutes left.
2 minutes. Okay, perfect. Is there a final question? The link to the referral will be put in the chat for quicker access before the slides are available. Yes, absolutely. We can get that. I can get that pulled up just as soon as I stop screen sharing here. And then Karen, thank you for acknowledging this is very difficult work, especially for people who are experiencing their own challenges. I love peer support, compassion fatigue. Yeah, that's one of the reasons why we developed the peer support for peer support workforce initiative is recognizing that vicarious trauma, secondary traumatic stress, compassion fatigue, the cost of caring, that is very real, especially for folks with lived experience working in the field. And so we developed those free support groups as a way to build connection and help reduce some of those challenges for folks. But yes, absolutely, it can be challenging work, and it's important for us to also seek support as we need it, seek supervision, identify natural resources, things that help fill our cups back as well. Thank you for sharing. Okay, and I see we are just about 9 a.m. So thank you so much for listening, for inviting us and having us here today. I will get that referral link placed in the chat and just appreciate you sharing your time with us. Thank you. And Michelle, it looked like you might have started to say something.
Just,
On mute.
I didn't realize that somebody asked for the referral link. So thank you everybody for having us. It's wonderful to be here and to share about all the things. And you're welcome to come to our peer support for peer support or peer zone for peer support.
Thank you so
Thank you.
much. It's a lot of great work going on in advocacy. It's really admirable what you all do. So thank you for getting those resources to us and the people of the community. Great.
Thanks so
We're
much.
yeah, thank you. It's awesome. I believe we have the Hillsborough Recovery Center next, and it's Jessica or Kristen that's going to be sharing some information about the newly opened Recovery Center in Hillsborough. So Jessica or Kristen, the floor is yours.
Hello, yes, good morning. This is Jessica Cashman. And great, look, those are my slides. Thank you all. Yeah, I'm Jessica Cashman. I work with the Behavioral Health Division in the Special Projects as a Senior Program Coordinator. And one of our special projects is the CAT, which has been such a fantastic project to work on. And Adrienne and Michelle, thank you so much for giving me such a great segue into this. I really appreciate it. Super excited to be partnering with you all as well. So the CAT is the Center for Addictions Triage and Treatment. We can move on to that next slide. Just to give sort of an overview of what the CAT approach is this is really going to be a program that offers that continuum of care, from withdrawal management, sobering, those peer services Adrienne and Michelle spoke about, having that culturally specific outpatient services provided, and also crisis services. Next slide. So like I mentioned, this is going to be really a coordinated services model so that there's going to be really no wrong door approach so that we are capturing our community members when they're in need of these services and really helping to support them every step of the way in whatever way that they feel they really need that support. And we're bringing together all these really fantastic community organizations to be able to provide these services, all under hopefully one roof. Well, actually, there's two roofs. That is part of the confusion, which I will also get to. So next slide. So who is going to be served? It's going to be 18 and older. People who have Medicaid, uninsured, commercial insurance, they're not going to be turned away based on their ability or coverage to pay. And as always, all services are voluntary. So then the next slide is the Hillsborough Recovery Center. So the CAT is Service Model, which is the Center for Addictions Triage and Treatment. And we have 2 locations. One is the Hillsborough Recovery Center, and one is the Beaverton Recovery Center. We just launched the Hillsborough Recovery Center on Monday. We're doing a staged launch, so not all services are available yet. But on Monday, we literally just moved in. I know, it's so exciting. It's such a fantastic facility. But currently, right now, Washington County is there, and Hawthorne Crisis Services by LifeWorks is also there. So we are currently working out of that building. And over the next month or 2, we're also going to be having Solutions Group Northwest move in, offering that outpatient treatment in Spanish. We're also having the peer supports. We did hear that the name was possibly changed to the peer company. Okay, yeah. So y'all are going to be with us. We're super excited about that. There's also going to be housing access and navigators by Project Homeless Connect. And there's also going to be health services offered by Virginia Garcia Memorial Health Center. This will all be done at the Hillsborough Recovery Center. And like I said, literally Monday, we opened up. Over the next month or so, we're going to have more of these services starting to come online for everybody. So yeah, you click off to the next one where you get to see the next slide, there's the front. It is an amazingly, yes, gorgeous facility. So welcoming to, our community members, which I'm really excited about. You can move on to the next slide. What is that? Okay, so yeah, here's the building design. Here's a map of what it looks like. So you can see the Hawthorne Crisis Services over to the right if you're facing this. We have the outpatient, we have the pier, and I cannot wait for you all and for the pier lounge to move in. I heard there's gonna be a foosball table. Like it's gonna be amazing. Really warm and welcoming. And as you can see, it's not necessarily a cafeteria. This was an older map, but I have a photo, the next photo, I believe. It's really just a community gathering space, which is really, again, thank you. See, that is what it looks like. And just really warm and welcoming where people can meet and gather right there. So yeah, next slide. So to sort of talk about some of the confusion with the split campus approach. So we're going to have the Hillsborough Recovery Center and the Beaverton Recovery Center. The Beaverton Recovery Center is still in construction as we speak. That recovery center, we're hoping to open, it's slated to open in November. So if we can get to the next slide, I'll give you a sneak peek on that, which I know most of you already know this, but just going to give you all the information again. So this location is the location that's going to have the sobering, the withdrawal management detox, some transitional supports, and residential treatment. Again, that should be opening in November, and all those services will be provided by CODA. If you click to the next slide, you get to see a rendering of this is what it should look like in the future. They've been really doing a lot of work on this building, and it's also really exciting to see this, really come to fruition for our community members who need this support. And then the last slide. Question. Yeah. So I know I sort of went through that really quickly. I was told to do like 5 or 10 minutes. I think I got 7, so right in between. But just the big news is that the Hillsborough Recovery Center is open and opening, and that's really exciting. And the Beaverton Recovery Center will be opening in about November. And we welcome you all to come by and just say hi, have some lunch there. There's also a really great outdoor back patio. So yeah, you're welcome to come by and say hi. Any questions, anything I can help with, you're always welcome to reach out to me. There's also the CAT general email box. We also have a website, and you can sign up for our newsletter. Oh, there is a chat. Perfect. You got the referral link in there. So yeah, if there are no questions, again, always feel free to reach out to me, to reach out to the CAT general email, or stop by. Hours, really great question. The hours will be dependent on each service provider. We do know that like the peer lounge, the peer services are going to have hours that are after typical business hours and possibly on the weekends. But they can definitely, each provider can really give you information on the hours. In terms of the crisis, Hawthorne Crisis Services, that's 24/7 every day. Thanks, Lindsay. Oh, that was directly to me. Sorry. So yes. Any other questions, please feel free to reach out.
Thank you, Jessica.
You're so welcome.
Great information. I'm excited there's another one coming up. Okay, let's see. So next we have Kisa Kwambek, who's going to be talking to us about the results from the annual Community Connect survey. Kisa, whenever you're ready.
Hey everybody, thanks so much, Charlie. I'm gonna share my screen here. So yes, I am here to talk about our annual, hopefully that is great, our annual Community Connect survey. This ran May 5th through 18th, and we collected responses from both providers and participants. And I will kind of take you through both. We'll start with the providers and then we will look at the participant feedback. I do want to caveat in this is not the only way that we collect feedback from our community. It is one of the ways. We have a lived experience work group. We have provider work groups. We have some culturally specific organization work groups. So there are a variety of ways that we collect feedback. This is one that we have done for a number of years. So we continue to do it, but it is certainly not the only way that we engage our community in ensuring that our system is continuing to improve. So I will dive in. This is our provider results. We had 26 total responses for the survey, which was fewer than last year. So I was a little bit sad to see the decrease in response, but good to know I should do more engagement, more reminders for next year. We had 12 total agencies represented. And I like this piece about how long folks had been there. Last year, we had a lot of folks reporting that they were with their agency 1 year or less. And this year we had more responses for folks 1 to 3 years. I like to think that could mean that we have folks that are continuing to stay with the agencies that they were hired at and continuing to do that good work. So, but good to see that we have a variety of length of service responses. So folks who have been engaged in our system for different periods of time. Next, we have our provider responses by race and lived experience. So we note that respondents may be in multiple categories for the race and ethnicity category. We did have pretty dramatically increased representation this year from respondents who identify as Hispanic, Latino, Latin. So there, that was exciting to see as well, that we are getting a little bit more diversity in our responses. The lived experience question was new. It was added this year based on recommendations from this group last year. And also really great to see that exactly half of our respondents have previous experience of homelessness. So that's providers, staff who are working in our system who have lived experience and are bringing that expertise with them into the work they do every day. So it was, thank you for that suggestion if you made that last year, and great to see that representation in our system. For interagency, this question is around how the goodness of our interagency communication. So how is the flow of information between our partners? We did see a slight decrease this year in the percentage of folks who were agreeing or strongly agreeing that there was good communication, which we will talk about in a couple of slides of things that we are talking more about to increase that. But in general, some of the specific feedback was requests for consistent types of communications for new policies and procedures, increased understanding of what types of services are provided by other agencies within the system. I think this making sure that folks are aware of this space and aware of the presentations that happen here at the HSSN is something that we can definitely increase talking about, because I learned so much this morning, and it'd be great for everybody to have that kind of information. And there was a general desire for increased teamwork and communication between case managers at different agencies to provide a warmer handoff and or better services for participants that they are mutually engaged with. So some things that we're already talking about as far as improvements, we are including a warm handoff policy in our program manual for the start of the next fiscal year, which starts in July. Ideally, that would increase interagency communications during specific points where participants are transferring from one agency to another. So maybe working with a street outreach provider at one agency, moving into shelter at another agency, and then maybe housing with a different agency, that at all those points we have intentional overlap between services, so that warm handoff can really be successful for participants. We also have a goal to create more digestible information on services provided across our continuum. That's something that Katie brought to us when she joined the county, is realizing that we do need that greater system to build that greater system knowledge. So that is on our list. And we're also working to streamline how our policies are rolled out and when. So trying to limit changes to quarterly at most, sending a memo to all agencies when something does change, as well as documenting them in our program manual about what has changed in that program manual. So really taking those responses to heart and thinking about how we can improve our communications moving forward and help facilitate the increase of communication between our providers. As far as phase 1 assessment accuracy, if you are new to our system or just visiting, phase 1 assessment is the name of our intake assessment into our coordinated entry system. So we did actually have a slight increase in the perception of accuracy on assessments, which is great to see. It's very slight, but still positive direction. And we've done a lot of annual training around that, so I hope that number continues to creep up. But we all know that situations can change between the time they were assessed and folks show up for services, and certainly things can be interpreted differently as they're being reported and recorded. So certainly more room for growth in that area. This is providers' perception of how accurate referrals are and being able to connect with those referrals. So we have 62% responding that referrals are usually or always accurate, and that's to both our shelter and housing programs. Respondents were from all over our system. So we did have an increase in sometimes accurate. So we do really, again, want to think about what we can do to improve that accuracy. We had some general feedback of participants with too high of needs being referred to permanent supportive housing, participants who could have been successful in rapid rehousing being referred to permanent supportive housing, participants with shelter referrals who resolved by the time they were matched to shelter, and participants' eligibility and intake not matching what was on that phase 1. So this could represent a lot of things, both participants' situations changing, and again, that accuracy of data entry on the phase 1. So there's quite a lot of factors at play for these situations. As far as being able to contact referrals, a lot of the no other responses were more like sometimes able to connect. It's about 50-50, and some more information on challenges with phone numbers or challenges connecting with other providers. So the no was recorded as technically a no, but some of them were sort of a 50-50 and not a straight no. All right. As far as training, as it relates to Community Connect training, about 73% of respondents agreed that they received an appropriate level of training related to Community Connect, and 85% said that the Community Connect training was accessible. The training accessibility was a new question, so I don't have anything to compare from last year. The appropriate level of training, the percentages are about the same as last year. Some specific feedback was requesting monthly trainings as optional, and increased HMIS training. So we do have, as far as the monthly trainings, it's definitely something we can consider, and how to make more optional trainings available. Increasing HMIS training, we are really excited. We have a new staff person coming onto our HMIS team. We had someone leave, and so we're having someone new come in, and they are going to be tasked with reviewing all of our training materials and making updates as needed. So anytime that they're seeing things that don't match or don't line up in our training materials, they will be flagging that so we can make sure to update it. We also request that if providers in our system are seeing specific discrepancies in our HMIS workflow documents that are in Power DMS, please submit support tickets that reference the specific training guide and the step where things aren't matching up. It's really helpful when we flag those. Often we've looked at them so many times, we're just not quite taking in the same errors or discrepancies that you all are. So we are always open to that feedback. The great thing that I noticed in this feedback area was that last year and the year before, we got a lot of comments around confusion on how matching in our system works. So I am hopeful, that makes me feel hopeful, that our move to matching in our case conferencing space has really increased transparency around how Community Connect works technically in order to match people who are on our prioritized list to housing resources specifically. So hopefully that is doing its job, but we will continue to get feedback in that area. Some provider responses on system improvement, ability to view a wait list, increased accuracy on those phase 1 assessments and contact information, more training for those completing phase 1 assessments, more specific understanding of how questions on the phase 1 directly relate to eligibility, increased preparations with participants prior to housing referral, so for things like document collection, to make sure that folks are really ready to hit the ground running when they're matched to a housing program, increased visibility in HMIS, ability to share more information with participants regarding wait times, and considering how participants are prioritized for medium-term versus long-term resources. So in the works, we are working with our regional partners to identify common assessment questions, which can be aligned and simplified, really focusing on the simplification in that process. And that could help us in some of these ways in 2 ways. First of all, if someone has answered that question in another county, the hope is that that information is able to be pulled into our county so the question doesn't need to be re-asked or can be just confirmed with a participant. More to come around that. The next piece is anytime we have the opportunity to simplify questions and make them more understandable, easy to communicate, easy to explain, then we can increase the accuracy of data entry in our system. We are also having conversations around prioritization changes, and that will be happening in alignment with the work to update our local implementation plan later this year. So I'm sure there will be a variety of opportunities that are presented and places to provide feedback around prioritization and our local implementation plan. So really excited for that work and to be able to dive in further there. We do have work underway with our regional partners in Multnomah County and Clackamas County to identify a new HMIS provider that will ideally make data entry less complicated and therefore increase accuracy. I will caveat that that process will take a number of years. But we are very excited to get us on the right track to a provider that will hopefully allow us to increase that accuracy. We're always taking considerations on how that phase 1 training can be updated to meet the needs of our providers. And our HMIS Regional Governance Committee is working towards approving and considering visibility changes in HMIS that would increase visibility for all users. So there's a lot of work being done to address some of these pieces. All right, so moving into our participant results. First of all, I wanted to just cover how the survey was offered. We had an online survey that could be optimized for a phone or tablet. The link could be sent to the participant. We also had QR codes on a flyer available that could be given to a participant and taken. We had paper forms. And yes, there again, that PDF with scannable QR codes were sent to all organizations who complete phase 1s. Our survey and flyer were both translated into Spanish. Additional translations could be made upon request, and we'd extend the survey response period if folks did have other translation needs. The online survey could be immediately translated with web-based browsers, so that could have been an accessible option for folks needing additional translations, and that paper form could be translated as well. We didn't receive any additional translation requests this year. So response volume, we had 25 surveys completed. That was more than the last 2 years, so happy to see that. This year we had a big increase in paper surveys being returned. We had 11 paper surveys and 14 online surveys. We also had a huge increase in the number of Spanish language surveys that were completed. In the past, we haven't had any, and this year we had 8. So really excited to see that folks were utilizing that and able to provide responses in the language that was most accessible for them. So excited to see that. This is kind of an overview of where assessments were completed. Overall, majority completed with either Community Action Organization or the Community Connect phone line, which is run by the Community Action Organization. A lot of folks reporting at their local nonprofits, outreach workers and shelters. So just overall increased responses from participants who completed a phase 1 with our other partner agencies aside from CAO. So it is really exciting to see that more folks came in and shared their feedback. This is our responses by race. Again, some participants were identified in multiple categories. And this year we saw an increased response from participants identifying as Hispanic, Latino, Latina, or Latinx. So that was our respondents by race this year. How the phase 1 was conducted, the majority of time, either folks walked into a location and received an assessment at the same time, or they were asked to schedule an appointment. Everyone who was asked to schedule an appointment reported it was easy to schedule an appointment, and they were able to make that appointment very quickly. I think we had one person say that their assessment was conducted with a resource book, and I'm not quite sure on that one, still trying to piece it out, but overall, most of these made a lot of sense. We ask if additional resources were provided during their or after their phase 1 assessment. Participants responded multiple items for these. So overwhelmingly, folks were provided information about emergency shelter and housing programs, 211, and as far as other, they were provided resources to referrals to food banks, referrals to street outreach teams, snacks, and hygiene items. Participant responses on understanding next steps. In 2024, we had 53 participants responding that they understood the next steps and what happened next in the assessment process. In 2025, we had a huge leap to a 96% response saying they understood the next steps and what happens next in the process. So it's a really interesting huge leap in that number. Yeah, wanting to dig more into how providers were asking that question or what is being communicated now to participants as far as understanding what their next steps look like. So participants, we had some new questions this year that included, do you understand why the questions are being asked? Do you understand what the questions mean? And do you feel comfortable answering the questions honestly? And all respondents agreed or strongly agreed to all of those statements, that they understood all of these pieces. So that was interesting feedback as well. Multnomah County used some of those questions when considering their assessment updates in the last couple of years. And so we wanted to try and get that feedback as well, as it was helpful for them. And yeah, just interesting piece here. Participant comments. For these comments, I tried my very best to not alter participant content comments in any way. I took out specific agencies or staff members that were mentioned. So these were the comments that we got back. Overall, folks reporting folks were organized, attentive, nice, that it was easy, very helpful. So welcoming and helpful. Just got a lot of that. Very good service, excellent service. So that was nice to see about our folks who are giving surveys out. Oh, I don't think, somehow I missed this slide, but oh, I apologize. We also asked a question around staff professionalism. I'll make sure to get that slide in and make sure it's uploaded. But staff were also overwhelmingly reported to be professional during their phase 1 interaction. As far as improvements, we had so aging out of some services, that being a concern, but they felt like it was a achievable concern. Taking time to be placed in programs, more concrete solutions, shorter wait times, places to hang out and wait for shelter lottery, help with phone, accurate timeframes for placement, an instant 3-bedroom home. I wish that we could just do that for everyone immediately. But overall, good attention and treatment. So that's kind of what we had as far as feedback, and generally the theme, which we see year to year and are constantly considering how we can make improvements on, is that piece around communicating timelines to participants, which is very challenging within the context of coordinated entry systems. I did want to, this is my last slide that I wanted to leave with. This was the longest comment we got, but so I had to give it its own slide. But I think just is a really sweet example of how all of our systems can work together to really support people who are in high crisis situations. It was a participant who's in a hotel with a newborn baby, didn't have funds to pay for the hotel. They connected with an agency who connected them with shelter. Not feeling stressed now, the room is comfortable, mental health is feeling better, feeling hope and peace, and being able to start working on their career again. So being able to really restart their life by being connected with the various agencies and shelter systems in our community, and wanting to tell the world how great they are. So I can't tell the world, but at least can tell this group that this participant is so grateful for the services that are provided in our community and the amazing work that all of you do. So that is all that I have for you today. I do have this last slide on some other data. I get asked about questions on data all the time here. I have shared the data that I have available for you today. Washington County Supportive Housing Services fiscal year 24-25 third quarter report is available online. Our annual report from the previous fiscal year is available, and we just released data on our point in time count. So wanted to make sure that those were available for folks as well. That's all I have. Thank you very much.
Thank you, Kisa. Thanks for sharing that last slide. It's always amazing to hear success stories, smaller or big. That's why we're doing the work. So thanks for giving us that piece of goodness today. So I don't think that we have any public comments, so we're just going to move into general business. And first we have Trinard May, who's going to be giving us equity and inclusion updates.
Hello, everyone. Great to see some familiar names, one of which I haven't seen in a while. So hopefully you can hear me, and we will try to share our screen. And do folks see the slide? Starts with equity and inclusion efforts. I can get a thumbs up or make sure we're on the right page. All right. Thanks, Mayor. I see you first. And Holly, I saw the icon. Appreciate it. All right. So going to be relatively brief. Folks that do this work, that are in the equity space know that these generational and systematic type changes are relatively slow moving, especially in government, which is important and affects our customers. But I will bring you through sort of where we're at in most of our efforts. First and foremost, we went through the process of interviewing, evaluating, and hiring a fellowship participant, a PhD candidate from Portland State University, and they will be responsible for investigating and identifying disparities between the needs in housing and the availability of the solutions of housing. They'll be doing detailed assessments that evaluate HSS program data, including Community Connect, access and referral, service delivery methods, and culture-specific service providers. They'll also be evaluating equity data collection practices, among other. We had very good candidates, and they informed me during the process of other ways to do this work. So we're really excited about them starting. The one we hired is actually an international student, so she won't be available until the 1st of August, but we're still really excited about that program. Also, currently, as far as centering equity and inclusion, working with the Joint Office and the Tri-County leaders from, basically myself, Clackamas, and Multnomah, taking through some of the issues that our various counties are encountering, including providing a learning space for those of us who are doing this work and for those that are conducting RELP meetings, which I will discuss a little bit here shortly. Since I last spoke, we were able to stand up our culture-specific organization cohort. We also had a second meeting, great feedback from the CSOs. That space is really there, really two parts. Is one, as far as county to CSO provider interactions, provide information, answer questions, foster that relationship, but also so that give the CSOs opportunity to discuss with themselves, problem solve, maybe possible collaboration opportunities to serve our many clients in the best way we can. Also looking currently at continuing to offer our equity, diversity, and inclusion training. We're evaluating how that's been done in the past and what changes can be made with our contracted provider. We're in the process of doing that. And then also, I mentioned last time that we are in the middle of, we were beginning, but now we're sort of in the middle of training and implementing our process for our RELT, or Racial Equity Lens tool. And for those who may not be familiar with what a RELT is, I think it's pretty important to know because it's pretty significant. It can really have a big effect on how businesses run and things are done in government. It's basically a set of questions we ask ourselves when we're planning, developing, or evaluating a policy, program, or decision designed to integrate explicit consideration of racial equity in decisions, including policies, practices, programs, and budgets. Key. And it helps analyze the equitableness of an action in decision-making process. A racial equity lens tool will not tell you what actions to take, but what it does is it it sparks a conversation, allows the folks with expertise in the program or policy to put together action plans, to set up secondary meetings, to hold each other accountable. It's a very effective tool that's being used over the 3 counties, Clackamas, Multnomah, and Washington County. I'm sure I know other counties are using it, but we are going through the process of doing a regionalized effort so that we're all kind of singing from the same sheet, as they say. As far as implementation is concerned, I mentioned this before. We have now started. We were about to release the possibility of it. We have started our racial equity lens advisor pilot. This is where we have a representative from each of the 3 branches of homeless services. They have been trained, and now they are conducting these meetings and having these implementation meetings with their individual branches. Sometimes this will spread across multiple departments, multiple divisions, but this is our pilot to sort of get the ball rolling and figure out how this could be best done, first in homeless service and then housing department as a whole. Those advisors are the beginning of our work group, so we're going to work through any challenges we may face. They'll also be rolled into what I spoke earlier about providing a learning space for folks in the region who are doing this work. So they'll be moved into that space as well to provide them with support and resources that they may need. And then we're also looking to expand the training. So the advisors was sort of the second step. A lot of folks have not been able to get access to our regionalized training in housing. So we're going to be rolling that out here towards the end of summer to provide more folks within the housing department the opportunity to train in the tool before we roll out any other new parts of this initiative. That's it for me. Thank you. I'm going to put my email in the chat. If you have any follow-ups, questions, or any opportunities maybe to collaborate, please feel free to reach out. Thanks.
Awesome. Thank you for those updates. We're going to move into the updates on the Solutions Council. Nadia, whenever you're ready, you have the floor.
Hi, I'm gonna try to see if I can do this while holding a baby. I want to quickly share my screen. So Solutions Council, along with a lot of the other boards and commissions in the county, are unifying kind of how we publicize our meetings and post materials and meeting information. So I wanted to quickly show everyone here how to do that or how to access it. This is our website, washingtoncountyor.gov. If you go to government and then Board of County Commissioners, board meeting schedule, that's where you'll get washingtoncounty.civicweb.net. And there's a portal for all of our boards and commissions. The Homeless Solutions Council is a little way down, but you can see here that all of our meeting materials are up here. You can click on the link. You'll get the agenda. The agenda straight from there. You can get the presentations, any kind of information. There's also the recordings, meeting video, where you can see what we did. So in May, we went over the point in time count. There was a presentation, the SPM presentation. There was also, we shared the letters of support that were sent to the Oregon Housing and Community Service as part of the legislature. So that's just a quick rundown of how to get to these meeting materials. And I can also, in our digest, I can provide those links. So if anyone wants to catch up on Homeless Solutions Advisory Council, that's all there for you. And that's all from me.
Thank you for those updates. Okay. So that is the end of our meeting. I just wanted to remind all of you that there's going to be no July meeting. So we're going to be meeting on August 6th, still 8:30 a.m. Also a reminder, if you or your agency is interested in offering a presentation during our HSSN meeting, please reach out to Lindsay, and Lindsay will drop her email in the chat. Yeah. So happy to give time back if there's anybody who has any events, kudos, highlights, agency events, anything like that. Feel free to unmute or pop that in the chat. Give you a couple of minutes. Otherwise, we can adjourn, but I'll give a couple of minutes. Looks like people are escaping and we don't have anything, any hands or posts. So I'm going to go ahead and let everybody go. Have a great Wednesday. Thank you for coming, everybody. Bye.